COVID-19 morbidity and mortality in the nursing home setting. What does that mean? It meant that in an individual where you have infection in a nursing home and you looked at the groups, be they staff or residents, who were randomized to placebo versus bamlanivimab, there was an 80% reduction in the incidence of moderate or worse COVID-19 at 8 weeks. Next slide. Here again is the Regeneron Cove antibody cocktail that I mentioned just previously. In this situation, it was within a household setting. In other words, where there is a infection in the household setting, and you're looking at the results of randomized the family members, either to this cocktail or to placebo, to determine if you can prevent, namely a post-exposure prophylaxis, or if you can treat early disease. The results were really dramatic. There was 100% protection against symptomatic infection in the group compared to placebo, and it reduced the overall infection rate by 50%. And importantly, those who were infected had 100-fold lower viral load and shorter duration of detectable viral RNA. Now, the reason I showed you the slide on the NIH treatment guidelines is that this is a very fluid area of research, particularly since, as I mentioned on a previous presser, that these monoclonal antibodies can be knocked out, particularly when given as monotherapy by different variants, which is the reason why, as we go on, and I will report to you at future meetings, you will see mostly combinations of these antibodies as opposed to single ones, because the single ones are most vulnerable to the variants that can knock them out easily. I'll stop there and turn it over to Dr. Nunez-Smith.
Thank you so much, Dr. Fauci. It's great to be here. I'm just going to return us to vaccines for a moment. So, as a doctor, as a frontline worker myself, I am very excited to see that more of my healthcare colleagues now have the chance to further expand their participation in the response. And as Jeff said, expanding the number of places people can get vaccinated, as well as the number of vaccinators, that's going to be critical for us as we drive an equitable response. We are faced with this reality that marginalized and minoritized communities are often the first to be forgotten, especially when resources are in short supply. And so we remain very committed to disrupting that narrative. With today's announcement, up to 700 new community health centers coming online, a doubling of pharmacy locations, and a surge in vaccinators, we're ensuring that equity remains at the center of our response. So I want to just take a minute to touch on the newly eligible vaccinators. To help meet the demand for more shots in arms once everybody is eligible for vaccines come May 1, the administration is expanding the pool of qualified professionals who will be able to administer shots. And so this list now includes dentists, optometrists, paramedics, physician assistants, and many more, including trained medical and healthcare students. Alongside this effort, the Department of Health and Human Services will launch a new portal to help individuals determine where they can sign up to volunteer to administer shots. We know a person's zip code is a stronger driver of health than their genetic code. So we will continue to prioritize getting the necessary resources to those areas and communities that have been hardest hit and are at highest risk. As we fight against centuries of structural inequities, we must be intentional about making vaccination easy and convenient for everyone. And key to that effort is having enough vaccinators to deliver shots in arms. So I encourage my fellow healthcare colleagues to visit the new portal at phe.gov. Check your status and sign up to help. So thanks so much in advance. And with that, I'll turn it back over to you, Jeff.
Thank you. Let's open it up for questions.
All right, we'll start doing questions now. Just a reminder to please keep your question to one question so we can get through as many as possible. First, we'll go to Carl O'Donnell at Reuters.
Hey, one thing I wanted to ask you. So there's been some commentary lately from a number of different a number of different groups about the impact of U.S. export controls on, both efforts in places like India to scale up global supply, and also, AstraZeneca's ability to get shots to the EU, where it's already been authorized. Just wondering if you can sort of share any views that you guys have on that, and whether there's any reassessment for how to make sure that the global supply chain is streamlined.
So the president has been very focused on fulfilling his responsibility to the American people, and we as a country have suffered over 500,000 deaths, more than any country in the world. So we're rightly focused on getting Americans vaccinated as soon as possible. And, as we've talked about, we're pleased with the progress, and there's yet a long road ahead. However, we know this is a global pandemic and that the virus has no borders. That's why the president is providing, the United States is providing the most funding of any country to COVAX, over $4 billion. It's why the president on his first day in office re-engaged with the WHO. And that's why just today, this morning, I participated in the Quad meeting with the president, and it was announced that we're working to achieve expanded manufacturing of safe and effective COVID-19 vaccines at facilities in India. And we also believe that the historic partnership between J&J and Merck will help expand capacity and ultimately benefit the world. So we will continue to prioritize getting all Americans vaccinated as quickly as possible, while at the same time understanding this is a global pandemic and making as big a contribution as we possibly can to worldwide efforts to get everyone else vaccinated.
Next question will go to Kaitlan Collins at CNN.
Thanks very much. I have two questions. One super quick. One is, how many people do you actually want to see vaccinated by July 4th in order to meet that goal of having those small gatherings that the president was talking about? And secondly, I think this is probably best for Jeff, but y'all have said we'll have enough vaccine for everyone by the end of May, not that everyone will get it by then. But if we're looking at these numbers, it looks like Moderna will have 200 million by then, Pfizer 200 million, and Johnson & Johnson 20 million. So that's enough, based on my math, for about 220 million people. So where are those other vaccines coming from in order to have enough for all eligible Americans by the end of May?
So Kaitlan, I think your 20 million is the figure that Johnson & Johnson has talked about in terms of their cumulative doses by the end of this month. The work that we did working with Johnson & Johnson and Merck to accelerate their manufacturing process, particularly the fill-finish piece, which is relevant in this time frame, has it so that Johnson & Johnson is now delivering at or near its 100 million by the end of May. So if you take the 200 million doses by the end of May of Moderna, plus the 200 million doses of Pfizer, plus the at or near 100 million completion of the Johnson & Johnson first contract, that is more than enough supply to vaccinate, vaccine supply to vaccinate all adult Americans by the end of May. Now we need to ramp up the number of vaccinators, as we've been talking about, and the number of places where Americans can get vaccinated, so that when all adults or Americans are eligible on May 1st, we can accelerate and move very quickly to get as many Americans vaccinated as soon as possible.
Maybe I'll just address the first question, and that is, we're not looking at a single metric of the fraction of people vaccinated in a vacuum. We're looking at it in the context of what's going on with the pandemic as well. So I don't think we can put a single metric on that, as well as what's happening in what science has emerged with regard to vaccinated people. So it's hard to put a metric on a single number.
Great. Next question will go to Cheyenne Haslett at ABC.
Hi, thanks for taking my question. How likely do you think it will be that states can open up to every adult before May when it comes to that vaccine supply? And when should states really be expecting the floodgates to open on vaccines?
Well, I think that the key here is that May 1 is a date that the president will direct using his authorities. There hopefully will be states, and we already have one in Alaska, that open up before then. And we're doing everything we can to encourage states to get as many needles in arms as fast and efficiently as possible. And this is where increasing the number of vaccinators, the number of places, the community vaccination centers, the federal pharmacy channel, the community health centers, as we continue to scale those efforts, we can accelerate from the 2.2 million rate that we're having on average per day now. Hopefully we can accelerate that further. And there will be states that open before May 1. But May 1 is an absolute deadline for all Americans to be eligible to receive the vaccine.
Next question will go to Sean Sullivan at the Washington Post.
Thanks very much. Can you talk a little bit about why the president felt the need to set out specific dates in his speech last night, and also how you intend to manage the public's expectation of what will happen by those dates? As you've pointed out, as the president pointed out, things could change, the situation could change, but how do you manage expectations from a public that might not always be paying attention to some of those developments, caveats that can make things change?
So I think we all would agree that it's important to have deadlines and goals. And we spent a lot of time working through the supply, the number of places, the number of vaccinators, and we believe May 1st is the right deadline, no later than May 1st. So we will have enough supply, as we've talked about, by the end of May, given all the president's work and leadership to bring forward the supply and create enough supply for all adult Americans by May 31st. We will have enough vaccinators and enough places for people to get vaccinated. And the funding from the American Rescue Plan really helps to ensure that we will have that capacity to do the 2.2 million shots per day that we're currently doing, and hopefully to accelerate off of that pace as we add more places and more vaccinators.
All right, we got time for one more question. We'll go to Zeke at AP.
Thank you all for doing this. First, for Jeff, can you speak to, with the expansion in the retail pharmacy program and as well as the community health center program, how many doses are you starting to divert into that stream, that federally controlled stream? I know you've told governors that their allocations will remain largely static for the coming weeks. And then just another one on the AstraZeneca in particular, with the stockpile of millions of doses here in the United States that aren't approved here, but they can be used overseas. With that, EUA still up in flux, why not just send those vaccines overseas right now to help out and save some lives with American allies in particular?
Well, the allocation that we'll make on a going forward basis will be based on performance of the different channels. And performance is a function of speed and efficiency, but as Dr. Nunez-Smith talked about, as importantly, equity and fairness. The next couple of weeks of supply overall are relatively flat before supply really starts to accelerate towards the end of the month and then into April and into May. Now, when I say relatively flat, at a level that's more than twice what it was 6 or 7 weeks ago. So allocation will be based on performance, and we believe that the community health centers are particularly important in order to reach hard-to-reach communities and to ensure fairness and equity. The pharmacy program is also structured around fairness and equity. So we'll make future allocations based on performance. As to AstraZeneca, we're following the exact same process that we did with the other 3 now approved vaccines, Moderna, Pfizer, and J&J. And just as we did with those vaccines, as we awaited for the completion of the clinical trial, and right now my understanding is that AstraZeneca is in the middle of its phase 3 trial, and then an FDA determination when they submit the data from the clinical trial. We have a small inventory of AstraZeneca so that if approved, we can get that inventory out to the American people as quickly as possible, as we just did with J&J. So AstraZeneca, we're awaiting the clinical trial and then the decision by the FDA and CDC. I think that's it on questions. I just want to thank everybody for joining today, and we look forward to seeing you on Monday. Thank you.